right? We see a lot of new medications being advertised on TV commercials, for hepatitis B. Uh, it's, it's been around for a long time, and usually, sometimes people don't get diagnosed till later on in life. I remember when, like the baby boomers, they never, now they're finding out they have Hep C. It's been many, many years since the 60s and 70s. I think of peace, love, and rock and roll. It was the time of free, everything. So the largest group at risk includes everyone born between 1945 and 1965. They did a lot of drugs, back then. It was times of great things, I guess. That's when I was consumed. But we are coming out with a lot of medications. I see a lot of TV commercials now that have new medications to treat the Hep C. Okay, so just remember that there's still a lot of research going on with these medications and things that are coming out to treat these Hep C infections. Signs and symptoms again. It is a silent infection. It is one. It's just very silent. They may never show signs and symptoms of it. Though they can bleed easily, they can bruise. Fatigue, poor appetite, again, jaundice, dark colored urine with these guys. Anybody with liver disorders have dark colored urine, okay? Itchy skin, the pruritus, the ascites, swelling in the lower legs, weight loss because they can't eat or they have too much fluid, confusion, and the spider-like vessels, the spider angiomas, okay? Causes, contaminated blood. Okay? Risk factors, healthcare workers, again, illicit drugs, HIV, tattoos, piercings, blood transfusions. If you received a clotting factor prior to 1987, hemodialysis patients, because they're always having their blood taken out and blood put in, it becomes a risk for them. Prisoners. Prevention. Stay away from the drugs. Watch your tattoos and body piercings. Practice safe sex. Hep C can cause, again, scarring of the liver cancer, and liver failure. All your hepatitis. Okay? Treatment, the antivirals. What happens when we put these people in the antivirals? They can't miss these medications. It's just like HIV patients. Um, they can't miss those antiviral medications, okay? So we have to make sure that there's a way that we can keep track of these people taking these medications. Because when you talk about Hep C, you're talking about people who, like my mom, are now almost 70 years old. You know what I mean? So do they forget more now? Yes. Okay. So maybe we need to put their meds out in a pill planner, things like that, so that they can take their medications. You have to think about these things with your older population. Like I said, those people that were born in the 40s and 50s, lived during the 60s and 70s, and that's more likely when they contracted the hepatitis C virus. And they don't find out about it till years later, so you have to, make sure that they can take their medications. Okay. They can have liver transplantations. Remember, there is no vaccine for hepatitis D. Hepatitis D. I'm not going to go much into this because D and E, I don't ask much about it. I don't. It's the same signs and symptoms pretty much.
But you have to have Hep B first.
It's a super infection of Hep B virus. You can have all the same signs and symptoms that John does. Darkening of the urine. Their urine's always dark and they are, feeling tired, nausea, vomiting, poor appetite. Ways you can get Hep B: sharing drug needles, having unprotected sex, accidental being sick. It's rarely spread from mother to child during birth. You don't get it from drinking or eating contaminated food, hugging an offensive person, shaking hands, blah, blah, blah. If y'all remember when HIV came out, you all probably don't. I was born in the 70s, so when HIV came out, everybody was scared to go use the toilets in public places. They had us scared to death at that time because they were like, oh, God, you can get it from a toilet seat. Nobody knew how it was contracted in the early 80s, you know what I mean? So it was like one of those things, people got scared, they wouldn't use the bathroom, don't sit on that toilet seat, and everything. It just was a nightmare, really. So I think a lot of people think that they can get these viruses from things like that, but you can't. It is a virus, but it's just not contracted in that way.
Brian White. Remember him, Brian White?
Yeah, I do.
He was a kid who had HIV, and he was kicked out of his school.
Yeah. He was one of the first young kids to get it because he had a blood transfusion. I believe blood transfusion.
Yeah.
Yeah. It was sad.
Yeah. I don't remember that. But I just remember all the scare tactics that came out with it.
Oh,
He was kind of the poster boy for HIV, and then he was thankfully used as, you can't get it this way. Don't treat people this way just because they have it. Don't, he
Well, they were scared to death during that time.
he kind of was a champion for how to be treated. It's like 11 or 12.
Yeah.
It was terrible.
All my grandparents did. Started messaging. They passed their boards.
Yay!
Everyone?
Hunter said, I passed boards with a 75. Thank you for everything. I'm officially a registered nurse.
Aww.
Nicole texted me and said, I passed, Mama. I'm officially official.
That's great.
Great day
I just happened to see my phone go ring, ring, ring. I was like, oh, who in the world? What in the world? That's all the students that just graduated. So,
Oh, great.
yeah, you got something to look forward to, right?
Yep.
Hepatitis E. It's typically an acute infection. Gets better without treatment. Contaminated water. You probably see a lot of that in Mexico, underdeveloped countries, don't drink the water. Now let's tell you.
Even at developed countries. When I get stationed in the UK, they said, you know, you can do two things. Go ahead and drink water, get yourself sick, get over it, and then you're good to go. You don't have to worry about drinking bottled water for the duration of your duty.
You know, when you go, even like when I went to Mexico, when I went to Cancun a couple of times, they cook with it. I still got it. I mean, even though I drank bottled water, I still got it. So, you know, it just, they cook with it. It's there. It's in their food. I mean, you know, so it's just.
Don't they tell you not to drink the water in any country that you go, or
I think that's just a myth, honestly.
a guy went to Russia and brushed his teeth with Coke.
It'll clean them, I'm sure. Again, our treatment is rest, drinking plenty of fluids, eating healthy, avoid alcohol because of your liver damage. That's one thing I can stress to you so much. Anything with the liver, then you do avoid alcohol and insects. Alcohol and insects. And they may use the antivirals with Hep B. Not likely, but they may. Symptoms: the arthralgia, the lethargy, flu-like symptoms, anorexia, nausea, vomiting, again, abdominal pain, diarrhea, constipation, and fever. Our goal is to treat adverse side effects, high-calorie diets. Anything with liver disorders, make sure they have high calories. They can't have protein, high calories. Okay. You want to promote rest and removal of the causative agent if you can. Dirty water if we were working in underdeveloped areas. Home care and instructions for hepatitis. Hand washing, I will stress it again. You have to do hand washing. That's the most important thing. Do not share bathrooms, hygiene materials, use somebody's toothbrush, etc. The person who has it should not be preparing any food. You want to avoid over-the-counter medications that affect the liver and alcohol. Blood donations. I think once you have it, you do not ever give blood ever. Okay. So that's important that you educate on that. Keep up with their vaccinations. A lot of people are against vaccinations, as I said. So education is an important thing. The fatty liver, they can have hepatic abscess. They can have liver trauma, the liver cancer, and end up with liver transplantations.
It said he had fatty liver, but it didn't say anything about fatty liver. But he was kind of yellowish.
Oh, yeah, non-alcoholic.
I didn't see
You
that.
don't have to be an alcoholic to have it. You know what I mean? You don't have to be an alcoholic to have cirrhosis.
Yeah, nothing in his chart said that he was an alcoholic, but he was a drug user, you know, and homeless. So
Did they test him for hepatitis?
not that I saw, but he did have a fatty liver.
To diagnose liver cancer, we will most likely do a CT scan. They can do a cryoablation if the liver is small, and they will have chemo and radiation with that. The concern with these people when they have liver cancer, and again, if you look at that, medications are metabolized in the liver a lot, right? So if you go into oncology and you have somebody who has liver cancer and you're treating the liver with chemo and radiation, and they have high blood pressure, you're going to have to look at all alternative medicines for these people, right? If they're metabolized in the liver, you're going to have to start thinking about all different ways and different medications that they'll have to take, okay? All right, a 59-year-old patient with a history of alcohol abuse spanning 15 years has been diagnosed with cirrhosis. The patient will be undergoing abdominal paracentesis today, which assessment findings alerts the nurse that the paracentesis has been successful. How about that? Okay. Right? Weight should decrease as the fluid is drained because you're going to measure that abdominal girth before it's done, right? Remember? Decreased blood pressure indicates shock. They could have hit something else, right? That's why you monitor the vital signs. How often?
Every 15
For how long?
2 hours.
They should not feel a sensation to urinate blind. So if you see a test question that says any of those things, elimination. Right? The patient's assessment reveals the yellowish coloration of skin and sclera, which laboratory values does the nurse anticipate? See? There'll be increased urine and blood. Increased direct, increased indirect. When a complete assessment of this patient is performed, what other signs and symptoms does the nurse expect? Baby, the patient tells the nurse that once he is discharged to home, he has no intention to stop drinking alcohol. That's definitely wrong. What is your appropriate nursing response? You cannot say B. And you do not say B. You cannot say that.
No, you said that a while ago. You continue to, you were talking about
Yeah.
education.
Oh, they're gonna know, yeah.
You continue to
But you
drink.
can say that. You just, if you want to, but, and I probably have.
That's what I said. See, but maybe
I
D.
probably have, so.
I'm trying to say, except that you understand the consequences.
You are annoying.
Steve.
You're not their mother.
I'm not anybody's mother-in-law.
I mean, yeah.
Asking the patient about quitting allows him to express his feelings. Okay, does it scare him to quit drinking? People who drink, that's how they fill their time, their empty time, right? So how do they're scared of what's going to happen if they do stop, you know?
Deal with their emotions and not.
Exactly. Exactly. Yep, you're right. Which assessment finding requires immediate nursing intervention in a patient with severe ascites? What is the priority nursing intervention in the management of a patient with decompensated cirrhosis?
Goes back to your fluids and electrolytes, right?
B.
Decompensated cirrhosis. We're going to go over AGs on the 21st. You all should know how to do the tic-tac-toe method or however they taught you in first semester, right? But we're going to go over it again. Because you're going to see a lot of respiratory acidosis coming up. You're going to see a lot of metabolic acidosis coming up. Nausea, vomiting, and disgusting. A lot of these things, and you're going to see some questions that are going to come out in the exams later on. So we're going to go over it again. So I would dig out my AEG material and be ready to do that on the 21st after Dr. Sager's lecture. Which does the nurse recognize as the primary reason for a higher incidence of liver cancer in the United States?
A.
Although HIV is making studies may be a little different in the next year. All right, now we're going to go to the pancreas. Not a need to know, just a nice one. Okay. Complications of pancreatitis: hypovolemia, hemorrhage, acute kidney failure, paralysis, and hypovolemic or septic shock. Okay. These people will have intense pain. Intense pain. We're going to manage our pain. Non-surgical intervention, IV fluids, and NPO status. I can't tell you how important it is for them to remain NPO and IV fluids on. They have to rest that pancreas. Every time you go in the room, we cannot have something to eat. You can't. Look at everybody. to 3 days is usually what they're, in uniform. And I mean, they want to eat right away. Like they'll come in, and if they can't eat, they just leave.
And then they're gonna end up back in the
Of course. So the primary drug class for treating this is an opioid, and you are going to give it IV. These people are going to be on IV pain medicine every 2 hours. It's going to be your one that they set the clock for, that they want the IV pain medicine every 2 hours. It's not going to change. They are in pain. I do not judge them. I don't care if they're an alcoholic. I don't care if they're a drug addict. They are in pain. Pancreatitis is very, very painful. It is not something that I would want or anyone would want. Once you get them through that initial stage, you have to promote nutrition because there are different things that will trigger pancreatitis. Okay? You always want to coordinate their care and transition management. These people will need follow-up care. Okay? Once they get it, they usually become frequent flyers and they come in all the time with pancreatitis. Okay? To evaluate them, you're going to see if they respond to treatment or not. Okay? If they follow their guidelines that you set forward for them. Okay? Most of them don't. Chronic pancreatitis, it is very destructive to the pancreas itself. And it is characterized by remission and exacerbation. Non-surgical treatment, we do IV opioids for them. They'll either have morphine, usually Dilaudid for them, because they are in pain. Enzyme replacement if needed. Insulin therapy, wow. They usually become diabetics. They usually become diabetics. And nutrition therapy, education. Well, foods trigger pancreatitis. So it can be acute or chronic. Acute pancreatitis is sudden abdominal pain. And it can be aggravated if they've had a meal, a high-fat meal, or alcohol. Okay? You want to assess for the Collins sign and the Turner sign. You want to assess for bile sounds in these people. White blood count, again, your liver enzymes. Acute pancreatitis, we're going to administer a pain medication. Instruct them to follow up with their visits. The most important thing I'm going to stress to you, first thing, I'm not going to give them pain medicine right off. First thing I'm going to do is make them NPA as a nurse, okay? People get a little confused. Yes, the pain is aggravating, okay? However, the very first order you're going to do is I'm going to stress that to you. NPO status is first. You're not going to give them a pain pill by mouth. Okay? So you're going to maintain an NPO status the whole entire time. And you're going to give them IV fluid. That would be the first thing I would start. Second would be the pain medicine. Okay? Fluids first. NPO status, fluids, IV medicine. You would need something on board for nausea. You want to notify the physician if they have acute abdominal pain or if the dark colored stools or urine develop. And why?
The liver.
And the liver goes back to the liver. Dark colored stool, dark colored urine, remember? They have a bleeding issue somewhere in the liver. Yes. What?
TPN or PPN, could you give that to these people?
There's no need for that. never seen anybody with TPN for pancreatitis. We just usually have pills.
Would TPN not affect you?
And it has lipids in it, fat too.
Yeah. It
And
would
it's
affect
also
the
going to be in your digestion, which is not going to let the pancreas
pancreas
rest.
rest.
It's going to have your carbs. It's going to have all your food in it.
Just like eating, yeah.
Chronic pancreatitis. Abdominal pain. They're always going to have abdominal pain. Even once they become chronic, they are usually in pain a lot. Diabetes. What are signs and symptoms of diabetes?
Thirsty.
What are your polys? Polydipsia. Remember these? Remember these? Your polys?
Urea.
Yeah. Need to limit our fat and protein intake. Education on diet. And I've even seen some carbs kick people into pancreatitis, so it's kind of hard to say that carbs don't do it too. Spaghettis will do it. You know what I mean? Like, I've seen that happen too with chronic pancreatitis. So these people are probably going to be put on insulin or oral hypoglycemics. You need to monitor them for fat in their stool, which is the steatorrhea. If they have abdominal distension and cramping. Okay. Weight loss and blood in the stool. Blood in the stool, blood in the urine is unusual with pancreatitis. Okay. But it is not unusual with liver disorders. Right? So if we have it in somebody who has pancreatitis, now they have a liver disorder. Alcohol related. Anybody's pancreatitis, my first question is, do you drink alcohol? I want to know. I just have to ask. I got to know. Because that makes a difference. You know what I mean? You need to teach them to abstain from alcohol, of course. Laying flat, you'll usually see these people laying in a curled up position or something like that because if they stretch that out, it stretches the pancreas and makes it more painful. Okay? They need to avoid any NSAIDs to disrupt the liver. Again, during an attack, NPO status is initiated. Very first thing is NPO status. I'm stressing that over and over and over again. NPO, IV fluids, then A 68-year-old patient presents to the ED the day after Thanksgiving, stating that he has eaten and drunk quite a bit. He states that about 1 hour ago he experienced a sudden onset of pain in his left upper quad that radiates to his left lung. He rates the pain at an 8 out of 10. The patient is admitted with acute pancreatitis. What laboratory finding do you think you would look up or would be questionable for acute pancreatitis? Your glucose is normal, right? White blood cells? Is that your lab sheets?
Yeah.
B, serum amylase of 200. Okay, that is elevated. Your lipase is normal because it's worth 150. 0 to 160 is normal. White blood count 4,800 to 10,000, right? Your glucose 82 to 110. I don't like that reading on this question. It came from an NCLEX book. It is different than what your book says. I do know that, so please don't say that. I do know that. But, and it's also different than what CAMC teaches you. Okay? So, but seeing a glucose of 80 is not dramatic. Okay? I don't start to worry unless somebody's below. I look at this as if you're below 50, you're hypoglycemic. If you're above 150, then you're hyperglycemic. I've learned to just do that because when you're looking at these questions, especially when you go for NCLEX and you see something like that, if it's 2 points, don't choose that answer because it's just a different rating scale. Okay? I mean, I can't tell you how many different hospitals use different things for hypoglycemics and hyperglycemics. Okay? 80 is fine. 80 is fine. I know your lab body sheet is something different. In preparing to cure for a patient, which conditions does the nurse recognize as a potential complication of acute pancreatitis? Select all but apply. Not sure of that. B, C, D, and E. All, with the exception of strep throat, are potential complications of acute pancreatitis. When the patient is asked about pain, he says that it is intense and continues. He states that sometimes when he curls up in a fetal position, the pain eases, as I just told you. They will curl up in a fetal position because it doesn't stretch the pancreas. Which medication does the nurse recognize that will provide the most comprehensive pain relief at this time?
A. A.
We'll start with morphine, I guess. Fentanyl. You're not going to be given. The patient has been NPO and is now tolerating food. What education will a nurse provide regarding nutrition?
A.
I'm sorry, Kathleen, you should be avoided. The patient is being discharged to home. What patient teaching will the nurse provide regarding when the patient should notify the healthcare provider?
If they have changes in their school or if they have like diabetes symptoms.
Severe abdominal pain, jaundice, clay-colored stools, dark urine. Yeah. We got most of them. In the care of a patient with acute pancreatitis, which assessment parameter requires immediate nursing intervention?
Always.
acute respiratory failure, 28 breaths per minute, normal 12 to 20, right? Go back and forth in your regular respirators, 12 to 20 is very normal. Make sense? Alright, for paracentesis, I went and pulled out my, have y'all used this book yet?
Yeah.
Okay. I suggest you do. Okay. So for paracentesis, alright, patient comes in the hospital, they're gonna have paracentesis. What is the first thing you need to make sure is on the chart?
Consent.
Yeah. Consent. You gotta have consent first because it is an invasive procedure, right? Or not?